Good morning, everyone. My name is Elizabeth Leone, and I am the chairperson of the New York City Local Early Intervention Coordinating Council. I'd like to welcome you all to our web-based LEICC meeting. New York City's local law number 103 and the New York State Open Meetings Law require open meetings to be both webcast and archived. This meeting will be recorded today. I will now review the procedures for the LEICC meetings. For in-person LEICC meetings, attendees should pre-register on the New York City Department of Health Early Intervention LEICC webpage. For web-based LEICC meetings, attendees will find a link on the New York City Department of Health Early Intervention LEICC webpage. Meetings are open to the public, but the audience does not address the LEICC members during the meeting. For this web-based meeting, we will not be using the chat or the Q&A features. For this web-based LEICC meeting, members of the public were asked to submit written public comment by emailing embeddedcoaching@health.nyc.gov. Public comments will be read into the record at the end of the meeting. LEICC members will raise their hands instead of raising their cards to make comments. LEICC members should keep their cameras on during the meeting. Transcription is available for this meeting. Written meeting minutes will also be made available. And now we will have the LEICC members introduce themselves. We'll start with Lydia.
Good morning, everyone. My name is Lydia Ledniak. I'm the Assistant Commissioner for the Bureau of Early Intervention, and I will pass it over to Roseanne.
Good morning, everyone. My name is Roseanne Saltzman. I am the director at Up We Grow and a committee member.
Kara, do you want to introduce yourself?
Sure. I'm Kara Chambers. I'm the director of the Legal Aid Society's Education Advocacy Project. I'll pass it to Chris Tan.
Hi, Chris Tan, Assistant Commissioner for Education Initiatives at ACS.
Jessica?
Good morning, Jessica Wallenstein, Senior Director for Children with Disabilities in the Division of Early Childhood at the DOE. And I'll pass it to Trish.
Hi, good morning. My name is Trish DeVito, Chairperson, Committee on Special Education, New York City Department of Ed.
Okay, and I think those are Patricia Gray. Would you introduce yourself?
Good morning, everyone. I'm Pat Gray, and I am part of the CUNY system, and I am here on behalf of BEI.
Thanks, Pat. Okay, I think that those are all of the committee members present today.
So we will now approve the minutes from the last LEICC meeting. Will someone make a motion to approve the minutes?
I motion to approve the minutes.
Thank you. And will someone second that motion?
I'll second.
Thank you. Okay, now please raise your hands to approve the minutes. Leader will count all of the hands. So let's get her.
Motion carries.
We will now move on to the LEICC membership updates. Assistant Commissioner Ledniak and I would like to thank Kara Chambers for serving on the New York City LEICC for the last couple of years. Thank you for your work on behalf of the Early Intervention Program, children, families, and providers. We also would like to note that your advocacy on behalf of children in foster care has really shaped the work on the EI program. Thank you so much, Kara.
Thank you. It's been an honor to be part of this process.
And now I would also like to announce that we have a new administration for Children's Services representation on the LEICC, Chris Tan. Christopher Tan is the Assistant Commissioner for Education Initiatives at ACS and leads the ACS Education Unit. His team provides technical assistance, trainings, and policy consultation to ACS and provider agency staff, as well as education support to ACS-involved families and other city partners. Previous to this role, Chris developed and led the education team with the ACS Division of Youth and Family Justice. Before that, he directed the Juvenile Justice Project at Advocates for Children, with a focus on direct legal services and policy advocacy. In all these roles, Chris has specialized in coordinating initiatives that emphasize the strategic integration of multidisciplinary approaches. We welcome you to the LEICC, Chris.
Thank you so much. Very happy to be here.
And now we move on to our next agenda item. We will have Lydia Ledniak presenting on the SCICC report and the EI program updates.
Thank you, Liz. And I want to welcome everyone to our summer LEICC meeting. This one tends to be a little bit light because we have a lot of people on vacation. However, there has been a lot going on in the program recently, and I am happy to present on that here today. So first, I'm going to talk about the June 16th State Early Intervention Coordinating Council. And as with all State Early Intervention Coordinating Council meetings, we have remitted all of the materials from that meeting to the members of the LEICC for your full review. So the topics that I'm going to specifically focus on in my report will be the administrative updates, the update from the Provider Workforce Capacity Task Force, as well as the training and technical assistance update. The State Department of Health made some important announcements at the last State Early Intervention Coordinating Council meeting. First and foremost, as you all know, the early intervention system is slated to transition from our current case management system called NICE to a new case management system called the EI Hub. So we were expecting the state to announce a new launch date at this SEICC. However, a new implementation date was not announced. However, the state did indicate that a new launch date will be announced after sandbox use of the system will be initiated by both municipalities and providers. And obviously, we were very happy to hear this because the state is really integrating a lot of our feedback. And the state came and talked to us at our last LEICC meeting about the hub and addressed many of the questions that providers and municipalities were raising at that time. And one of them was, will there be sandbox access? And at that point, they didn't think so, or they said there would be, but it would be very close to launch. But now it looks like there's going to be additional time provided for stakeholders to really test out and utilize the system. And I think that that is really has a lot to do with all of the advocacy and feedback that providers and municipalities have given the state around this point. The next item that was discussed was an update on the Covered Lives Bill. As you know, at the end of the last legislative session, the governor signed the Covered Lives Bill. And what it essentially does is that it creates a pool of money, $40 million, that should be distributed to state governments. And in exchange for that, early intervention provider claims will no longer be sent for adjudication to private insurance first. And the intent is to expedite provider payments, because if a claim gets sent to private insurance, it spends sometimes several months in adjudication before that claim is released for payment. And so what this process does is that it expedites payments to providers and also offsets some of the costs to municipalities and the state for this important yet expensive program. So the update that was provided was that the actual Covered Lives Fund has not yet been established. However, Public Consulting Group, who is the state's fiscal agent, has stopped private insurance billing for EI services. And so municipal escrow accounts are bearing that brunt now. The providers are starting to see faster payments for private claims that would otherwise go to private adjudication first. So, and it's important to note here, and I guess I'm going to keep noting it, is that it is critical for providers and municipalities to continue to collect insurance information. And the reason for that is, one, it will help us go back to the legislature and make an argument for possibly increasing the pool. And two, we want to ensure that the amount of work that folks need to do for a child who has private insurance and a child who has Medicaid is the same. We don't want something that was really well-intentioned to backfire and for folks to stop wanting to serve children with Medicaid. In addition, in order for us to collect Medicaid payments, Medicaid needs to know what percentage of our population has what kind of insurance. And so for all of those reasons, insurance information collection remains critically important for this program. However, the Covered Lives bill and the process that has been put in place is yielding faster payments on third-party claims that would otherwise go to private insurance adjudication first. I'm going to take off my insurance hat for a moment, but because we've all become great experts working in this program and needing to understand how insurance works. So the next item that the state provided an update on was updated early intervention regulations. And as you may recall, several LEICC meetings ago, I presented on what would be in that regulatory package. And so if providers or members want to sort of look back as to what is actually in that bill, all of these LEICCs are posted on YouTube. But they don't get a lot of views except for the advocates and providers who are interested in this content after. So we're not famous yet. So anyway, I'm sorry. So the regulatory package is in its last phase of review with the State Department of Health legal team. And while the state didn't really say the timeline for release, the way that it was presented made me believe that we would see a package released in the coming quarter. And so obviously at that point, I'm sure people will be making comments as to these regulations, but New York City will definitely be commenting on them. Okay, let's see. The other items that were talked about was new guidance was recently released that as of June 17th, occupational therapy assistants and physical therapy assistants may no longer deliver teletherapy services. All services by these professionals, which require supervision, right, to deliver early intervention services, have to be delivered in person. And so the way that we in New York City are going to be implementing that in order to cause minimal disruption in plans of care is that as of June 22nd, all new services authorized must be staffed by in-person OTAs and PTAs. But for children who are currently receiving OTA and PTA services being delivered utilizing telehealth, our timeline is to transfer those children to in-person OTA or PTA or other OT and PT services by the time of their next IFSP review. That is as much time as we were able to get, given the fact that this is a state education department determination. Okay. State Department of Health also talked about launching a promotional campaign to build the early intervention workforce that is expected sometime in the summer or fall of 2002. But I was really heartened to hear the state start to really talk about some of the barriers that graduates and people who are seeking their master's and want to work in EI experience getting fieldwork placements with early intervention providers. It's not only a burden on, say, an early intervention provider to take on a student, but the bigger issue is that many of the practice acts don't allow for early intervention placements to count towards degree requirements. And so I was really happy to learn that the state has started talking about this, because we obviously here in New York City have been talking about that for a while with all of the work that we've done with our academic partners. So it was really nice to hear that they are interested in actually exploring some of these structural barriers that exist to us sort of recruiting a new, younger workforce. The other thing that was mentioned is that the Office of Special Education Programs will initiate an audit of the state early intervention system. The other item that was discussed, and there was a lot of discussion around this point, so as of July 1st, certified school psychologists are no longer recognized as qualified personnel in early intervention. I will note that, and I put them up conveniently for you on the slide, Bills S8802/A9973 have passed both of the houses, the Assembly and Senate, to extend approval of these professionals until 2024. However, the governor, this legislation, based on what we understand, has not been delivered to the governor yet, and so it hasn't been signed. And so we continue to be required to transfer all of the children who are currently being served by these professionals. And this is something that is certainly impacting the municipalities and local EI programs. Downstate municipalities are more impacted than municipalities further upstate for whatever reason. So there was a motion made at the last SEICC to have the Department of Health allow for certified school psychologists to continue to be used until the governor makes a decision whether to sign the legislation or not. We'll see what happens, but we continue to be directed to move the children. Okay. The other thing that was discussed at great length was that early intervention received a 1% across the board rate increase, and many folks around the table had concerns about that, given the increase recently in adjacent systems, such as preschool, and whether a 1% across the board rate increase would really keep our system competitive with other early childhood systems. Okay. There was a report from the Provider Workforce Capacity Task Force. And again, we talked about the goal. The goal is to make recommendations to increase provider capacity, including teletherapy. Through the work of this subgroup, the state released competency areas for the delivery of evidence-based evaluations and services in the New York State Early Intervention Program. And Dr. Jeanette Gong is going to be talking to you a little bit about how we here in New York City are operationalizing and implementing those competencies across many areas. In addition, this committee developed a companion document for graduate programs to implement, to sort of explain, each competency area and lay out what might the learning objectives be within each one as they attempt to integrate this into their own curricula for the development of our future workforce. And that companion document was sent to, I believe, over 10 academic partners in the city and across the state for feedback. We've received very thoughtful feedback on that. And at this point, the committee is working toward integrating all of that into the companion document so that it can be released statewide. The other thing that this committee really called on the state to do was to release guidance on teletherapy, on the delivery of teletherapy, and not only about what is quality teletherapy, how should it be delivered, but also how should it be authorized. You know, I think right now we think a lot about all or nothing. And I think that, you know, we really needed the state to put some parameters on how we do this. And so the state was very responsive. And so we had a presentation at the last SCICC meeting that the state has initiated the development of teletherapy guidance. And I'm not going to read the topics to you. They're right there on the slide. But we are very, you know, excited to see what the state puts together, and we're hoping that the rest of the SCICC will get a chance to review it before it is released, so that it covers some of the issues that we're really seeing here in New York City with regard to quality in the delivery of teletherapy. Okay, I'm going to move on. I don't know if anybody wants to, let's wait until I go through these early intervention program updates for questions, if that's okay with you. Okay, so early intervention program updates. We've shown this timeline many times before. I'm not going to go through it. The thing that's happened since the last LEICC meeting is that New York City no longer requires masks in early intervention program settings, but that is in any early childhood setting, masks are no longer required, right? There was this initial March 2022 decision released that New York City schools no longer required face masks in over 5 settings. And now we've sort of caught up on the early childhood front with that as well. And so along with this determination that the city has elected to do, we have implemented revised guidance on a whole host of topics. And I think given how much change there has been, I would like to take a moment to take you through some of those changes. And then Dr. Kathy Canary, who's our medical director, who's just been wonderful in helping me sift through CDC guidance, will go over revised quarantine and isolation requirements that we have recently implemented. So first, mask requirements. As of June 13th, EI providers, therapists, teachers, and caregivers are no longer required to wear masks or physically distance while delivering EI services in person. Providers should wear a mask when delivering services to children who are at increased risk for COVID-19 illness, and that is any child who has a co-occurring medical condition, right? We all know who those children are. We have about 8% of them in the overall EI population, and so this is a very important note for us. Providers must also wear a mask when asked by a parent or a caregiver when entering their home. As of the December 20th, 2021 New York City Board of Health order that requires that New York City early intervention providers be vaccinated against COVID-19 remains in effect. And we here at the New York City Department of Health actively check vaccination records for compliance. But what I will say is that early intervention providers have been wonderful. They have been complying with this requirement. I think we all as a community understand how important it is to have a workforce that is providing services in a safe manner to our children who are unvaccinated. But that's about to change. Well, more on that in a moment. Vaccination requirement obviously does not apply to parents, guardians, or other household members of a child authorized to receive early intervention services, as we cannot mandate something that goes on in families' homes. Service delivery. The early intervention program will continue to offer both in-person and teletherapy services. Service coordination activities should be carried out in person, but may be conducted in any form and at any time and place convenient to the family. As of June 13th, evaluators may start bringing test items into children's homes if they are properly cleaned and sanitized. And the checklist that was specifically developed for teletherapy evaluations is no longer required if the obviously it's not required if the evaluation is being done in person. So also as of June 13th, we are no longer requiring the consent for EI program for in-person services, right? Because we are starting to sunset some of these extra requirements. So that form is no longer required for new or ongoing service authorizations. However, the consent to use telehealth must still be used for new service authorizations. I am hopeful that the state will revise that consent to be a more broader consent for the delivery of services utilizing telehealth and not really tie it so much to COVID. As of July 1st, the New York City EI program will no longer accept EI forms that require parent or guardian written consent using any email or text message workarounds. However, just a little note there, we are not stopping the use of our consent for email. So if there's a consent for email, at that point, parents and providers and our municipal staff will continue to communicate via email, but the form that is then remitted via email must have an actual signature on it. Okay. As of June 13th, we have ended COVID-19 case reporting, which is a big milestone for us. I think we're not the only system that's doing that. And so with that, we're no longer authorizing backup lines. EI providers may elect to keep children, caregivers, and staff groupings static. They are no longer required to do so. And they may elect to continue to limit the size of gatherings and restrict non-essential visitors. Bringing toys and other materials into families, homes, or community-based settings for the purposes of delivering EI services is prohibited, as it is not aligned with family-centered best practice. And I think we've all learned over the course of this pandemic that you could provide high-quality services without bringing a toy bag. What's next? As though that wasn't enough. But in addition to implementing everything that we've just talked about, current phone-based IFSP meetings remain in effect until in-person initial IFSP meetings are scheduled to resume. Sorry, there was a little typo there. A formal announcement will be sent in the coming weeks. We expect to initiate in-person initial IFSP meetings this summer. We are just trying to land on the right date to give ourselves and the providers enough time to adjust their practices and ensure that all staff are notified. I'm going to stop there and ask if anybody has any questions. Okay. Stunned. Okay, thank you.
Okay, so now we will move on. So we will have Nora Puffett, Director of Administration and Data Management, and she will be presenting on the data report and provider oversight activities.
Morning. So before I jump into the data report, I just want to note that I have now been doing the data report with the LEICC for more than 10 years, and I have never once actually produced the report myself. We never talk about the folks who spend all their lives to produce this data, but I wanted to mention that we have a whole research and analysis unit that does nothing but analyses of EI data all day. And I mention them today because I made their morning very difficult, and I will show you why, but I really wanted to take the chance to say thank you so much for all of the work that goes into this 3 times a year. So, next slide. So starting off with our recovery from COVID. As you can see, we're looking really good. We're really on track for the end of this year. We're currently about 400 children fewer than we were this time last year. In 2019, which is our base year. FY19 is the green, and the purple line is the current year, FY22. Next slide. And this is the slide that I found really hard this morning, which was looking at our current year, 2022, which we only had data through May for, and saying, oh my gosh, we're not getting back to 2019. And then I was informed, you really have to think about these things, we're going to get about 3,000 more referrals in June. So we really are going to be back up where we were in FY19, and this chart can be a little bit misleading. But as you can see, we've really made progress. And if we go to the next slide, you can also see that we are making progress with our equity goals. We are gradually getting the proportion of children who are Black children in the program to reflect the proportion in the city. We still have a ways to go, but we've definitely made some progress here. Next slide. This is general services. Again, as a reminder, services are always going to lag behind the referral trends. So they are still catching up. They went down a little bit later. They're going to go up a little bit later. But by next year, they should be back on track right behind the referrals. Next slide. And similar with race, where we actually are doing even a little bit better with that equity goal. So that's definitely very promising. Next slide. In terms of the waterfall, this is the reminder of when children turn 3, how far did they make it in EI? Had they been referred? Had they been evaluated? Were they found eligible? Did they get services? And what we're seeing is a very small drop in evaluation and a very small increase in eligibility. And so we're really keeping an eye on that to understand what that's about. Next slide. And this slide, of course, harkens back to what Lydia mentioned about covered lives, a reminder that we still need to collect insurance information. We really want to know who our children are and what their coverage is. And it's not possible that a whole 10% of them have no insurance whatsoever. The good news is that this is something that will really be addressed in the EI Hub. When it comes along, it will have reminders to update insurance. So that is the data report. And does anyone have questions about that before I talk about provider oversight? Okay. So in terms of provider oversight, we got started with our annual monitoring in February, and we will have data on that next time. We've only done a few agencies at this point. It'll be a total of 156 agencies again this year. It's a lot. We are focusing with the tools on ongoing service coordination, MDEs, and services, because we are really looking at initial service coordination separately. That has been a long-standing concern, and we really wanted to get at it with more than just our regular audit tools this year. And so we're taking on some different projects that will complement our regular work, especially around foster care, where ISC issues are really dramatic. And then finally, the fraud checklist, which we had done really last winter, but we're now getting out the last rounds of feedback to agencies about the checklist that they submitted. And for the most part, it was very positive. And we will be following up in the next year to see how they're able to implement them. Any questions about the provider oversight report? Okay.
Thank you, Nora. Now we will have Catherine Canary, Medical Director, presenting on the COVID-19 vaccines for children and quarantine and isolation updates.
Hi, good morning, everyone. So let's move right into the good news, which is occurring on several fronts. So the first piece of good news is that all New Yorkers aged 6 months and older are now eligible for COVID-19 vaccine. And the statistics as of yesterday include that almost 16 million doses of COVID vaccine have been given to New York City residents. 78% of all New Yorkers are fully vaccinated. 48% of children 5 to 12 and 81% of youth 13 to 17 years are fully vaccinated. 87% of all New Yorkers have received at least one dose. 55% of kids 5 to 12 and 91% of youth 13 to 17 have received at least one dose. So we're making good progress. Next. As of October 29th last year, the Food and Drug Administration authorized the emergency use of Pfizer's COVID-19 vaccine for children 5 to 11 years of age. And the Advisory Committee on Immunization Practices recommended its use. So this is kind of old news at this point in time, because by now these kids are actually eligible for boosters. But interestingly, the Moderna vaccine has not yet been recommended for use in the sort of, early, middle to childhood to youth population yet. An emergency use authorization was issued, and it's in the process of being recommended by the Advisory Committee on Immunization Practices today, even as we speak. So presumably, Moderna will be approved and recommended for children ages 6 to 17 years of age. The probably most significant thing for us in early intervention is that as of last Friday, June 17th, the Food and Drug Administration authorized the emergency use of the Pfizer vaccine for children 6 months to 4 years and the Moderna vaccine for children 6 months to 5 years. And in fact, the first doses were available to young children in the city yesterday. Next slide. We sponsored a couple of community conversations around COVID-19 vaccines for New York City's early intervention providers last fall. And these occurred in October, and then again in December after the vaccine was mandated, as Lydia mentioned. So we compiled and sent out frequently asked questions after that. I'm sure everyone has seen those. Starting this summer, we'll be delivering additional community conversations for early intervention providers, parents, and staff around the COVID-19 vaccines for these young children 6 months to 5 years now that they have been authorized and recommended. BEI has been collaborating with other partners in the health department to develop flyers and posters and other informational materials about COVID vaccine for young children, and we'll be disseminating these to the regional offices and provider locations as soon as those are available. And finally, we will be sending text messages directly to parents and caregivers through text to families. And we're actually very interested in any suggestions you may have for us about how to, most effectively get the word out about what some are affectionately calling baby vax, the vaccine for kids 6 months to either 4 or 5 years. We want to communicate with providers and families in a way that resonates with them. So any discussion or any ideas you want to put forth right now would be most welcome. Or any ideas that you want to send by email to me and Lydia would also be welcome. Okay, so let's move on to another COVID topic, isolation and quarantine. Next. So to provide some context, about 10 days ago on June 13th, New York City Early Intervention implemented revised isolation and quarantine guidance based on updated guidance we received from the State Department of Health. So these updates affect early intervention therapists, teachers, and staff working in all EI settings, as well as children in the early intervention program. Slide. So before we go into the latest updates on isolation and quarantine, I just want to review some definitions since it's really easy to confuse the terms. And just so you know, this information comes directly from the CDC's website, which has been a very useful source of information for all of us. So isolation is for when a person either has COVID symptoms or has tested positive for COVID. So that's isolation. Quarantine is for when a person has been around someone with COVID symptoms or a positive COVID test for at least 15 minutes in a 24-hour period dating back to 2 days before either the symptoms started or the date of that person's positive test. Fully vaccinated means that a person has received their primary series of COVID-19 vaccines, and a primary series is either 2 Pfizer vaccines, 2 Moderna vaccines, or 1 Johnson & Johnson vaccine. Up to date on vaccines means that the person has received all those doses in the primary series, those 2 or 1, as well as all recommended boosters when that person is eligible for a booster. Counting days is important when you're thinking about either how long someone has to stay in isolation or quarantine, if they're eligible for that, or the earliest someone's isolation or quarantine period can end. So day 0 is the date that a person started developing COVID symptoms or the date they went for a COVID test. Day 1 of isolation starts the day after their symptoms started or the day after their positive test date. And for quarantine, day 1, again, if their quarantine is needed, which I'll mention in a minute, day 1 of quarantine is the first full day after a person's last contact with the person who has COVID symptoms or the positive test. Next slide, please. So early intervention providers and staff who test positive for COVID-19 or who have symptoms but weren't tested can return to work after day 5. So again, day 1 is the day after their symptoms began or the day after their test date if they never had any symptoms. So they can return to work after day 5, assuming or if they also have either no symptoms or their symptoms are improving. They haven't had a fever for the past 24 hours without using, Advil, Tylenol, Motrin. And they can wear a well-fitting mask on days 6 through 10 after their either symptoms began or their positive test date. So just as to give you like a real life example, if someone develops symptoms, let's say on Saturday evening, after they went to a family gathering on Saturday afternoon, day 0 for that person is Saturday, day 1 is Sunday. So they can end their isolation after day 5, which is Thursday. I have to do my counting on my fingers, but trust me, I've done it a couple of times now. And so then they, assuming they meet the other criteria, they can return to work on Friday. Okay, next slide, thanks. So testing is not required for staff to return to work, but when they do return, they have to take precautions for 10 days after their symptoms began, or if they never had symptoms, after their test date. And these these precautions include wearing a well-fitting mask at all times, except when they're eating or drinking, and practicing physical distancing as much as possible, especially when they have to remove their mask to eat or drink. And that ideally would be done in a room without other people. EI providers and staff who don't meet these criteria can return to work after day 10, after their symptoms began. Slide. So for staff who are up to date with COVID-19 vaccines, again, meaning they're vaccinated and boosted, Or staff who had COVID in the last 90 days and recovered. These folks can work even if they were a close contact, meaning they were within 6 feet of someone with COVID-19 for 15 minutes or more over a 24-hour period. So, and that's not new. That's been in place for at least a couple of months now. Staff who are not fully vaccinated must be excluded from all early intervention settings and can return when it's after day 5. Again, day 1 is the day after their last close contact, and they can wear a well-fitting mask. Slide. So all staff who are a close contact, regardless of their vaccination status, and regardless of whether they're required to be excluded from the program or not, should take the precautions that we're all very familiar with for 10 days after that last close contact. And these include practicing physical distancing, wearing a well-fitting mask when they're around other people, staying as far away from others as possible, ideally more than 6 feet, especially when they're removing their mask to eat or drink, and monitoring for symptoms. And if symptoms should develop because they were exposed to someone with COVID, so if they develop symptoms, they need to isolate and get tested right away. Next slide. So isolation for early intervention children has changed a little. Children who test positive for COVID-19 or who have COVID symptoms but weren't tested can return to their center-based program or receive in-person services when it's after day 5. Again, sorry to beat a dead horse. Day 1 is the day after their symptoms began or the day after their test date if they never had symptoms. So they can return after day 5 if their symptoms have improved, they haven't had a fever for the preceding 24 hours without the use of fever-reducing medication, and they are age 2 or older and can wear a well-fitting mask. Slide. Children younger than 2 are not recommended to wear masks because of the suffocation risk. So these children under 2 and children over 2 who are unable to wear a well-fitting mask have to continue to isolate for 10 days, meaning they cannot receive in-person services or attend their center-based program. For young kids who have symptoms that look like COVID, but then they test negative on a COVID test administered by a healthcare provider, these kids can return to their program or in-person services if they haven't had a fever in the preceding 24 hours and their symptoms are mild. Slide. So quarantine for early intervention children is similar to quarantine for adults who aren't fully vaccinated. So these kids who are close contacts may return to their center-based program or receive in-person services after day 5, after their last close contact. Testing on day 5 isn't required, but it is recommended. And kids who are returning after quarantine should be screened every day on days 6 through 10 for COVID symptoms. And if they develop symptoms, obviously they should isolate and get tested right away. Next slide. Any questions? Thank you very much.
Thank you, Catherine. Now we will have Jeanette Gong, Director of Intervention Quality Initiatives, reporting on the ACS initiative and services coordination professional development.
Next slide, please. Good morning. It's great to be able to see everyone today. Today, I will provide a short report on where we are in terms of the BEI ACS data reports and on the foster care focus groups. Next. The goal for the revision is to streamline the ACS data report and make it easier and more useful for foster care agency workers to support children through the EI process. BEI developed a report revision with case status information color-coded by need for intervention And each status includes recommended action for the foster care agency to facilitate clear communication between systems and transparency to refer, retain, or help children transition. ACS convened a work group of foster care agency representatives to review the enhanced data reports and to obtain feedback. Next. BEI and ACS revised the report based on the feedback we got from the foster care agency representatives. These enhancements include adding the name of the developmental monitoring specialist assigned to the children in DM, and adding a new category to identify when the ages and stages questionnaire was sent out but never received. The June monthly report in the new format was sent out, and a follow-up meeting will be convened with the work group to obtain more feedback and to continue to make further enhancements to the data report. Next, I'm going to be talking and giving some updates on the BEI ACS focus groups. The focus group project was initiated to learn more about what foster care agency staff, parents with children in foster care, and foster parents experience during the EI process. The information we learned from the focus groups will be used to inform future policies and procedures and professional development trainings to improve the process for ACS children in EI. On April 22nd, the kickoff meeting with the consultant, CBER Strategies, was held. In May and early June 2022, CBER Strategies worked on the recruitment of the 4 focus groups: parents with children in foster care, with one in English and one in Spanish, foster care parents, and foster care agency staff that include case planners, educational specialists, and supervisors. BEI also worked with both ACS and with the advocacy groups like Legal Aid, Advocates for Children, and Brooklyn Defenders to help promote the focus groups among foster care agencies and with parents. BEI also recruited families via Text to Families in both the English and Spanish tracks. By June 14th, which was last week, the foster care parent and the ACS staff focus groups were remotely held in the evening from 5 to 6:30 and from 7 to 8:30 p.m. It was decided that the birth parents will be interviewed individually out of respect and sensitivity to their personal experiences. These interviews are scheduled for this week, June 20th. CBER Strategies will submit a report about the focus groups and the interviews by the end of June 2022. So that we should be able to report on these results at the next LEICC meeting. So this is my report and updates on the BEI ACS initiatives. Are there any questions?
I just also wanted to note that, ACS and the advocacy groups that Jeanette just mentioned also helped us review the screening criteria for the focus groups, as well as all of the guides that the consultant is utilized to actually conduct the group. And this has been a really great partnership with ACS under Krista's leadership. And we're hoping that the work that we're doing now, one, to improve the report, but also to get feedback from parents and foster care agencies will help us to shape the revision to our policy chapter, as well as make other recommendations for systems improvements, both internally to EI, as well as possibly to some of the foster care agency processes, and broadly our interactions with all of these various groups as systems. Chris, did you want to add anything?
I just want to echo that it has been a great partnership. It definitely seems like some really helpful information is coming out of the process, and I'm looking forward to the final report.
And I'll just jump in. I'd like to commend Chris and Jeanette for moving this forward so quickly and getting results so fast. I'm very much looking forward to hearing what the focus groups had to say.
Thank you. Thank you. Are there any other questions or comments? Okay, so then I'll move on to the next part of my presentation. Next, please. I'll provide information today about BEI initiatives to enhance service coordination and SC supervision in the New York City Early Intervention Program. Next, the BEI Hunter College Service Coordination Professional Development Institute, or SCPDI, was launched in 2021 as a result of focus group feedback we received from Black parents, service coordinators, and SC supervisors about what they felt would improve service coordination. Professional development training about family engagement, cultural sensitivity and implicit bias, EI family center best practices, better communication and collaboration, and greater supervision was a major recommendation across all three groups. Next slide, please. So last year, BEI and Hunter College, spearheaded by Patricia Gray, who's on the council, were able to launch both spring and fall series of the SCPDI. To measure change in knowledge, pre and post tests were administered, and this slide shows the means for the pre and post tests by participants who completed both in the spring and fall series. For the 6 trainings, the post tests show an increase in the mean compared to the pre-test, ranging from 12 to 18 points higher. Next. So I'm going to be showing a series of slides, and some of them I'm just going to summarize or highlight some of the findings that we got from the training evaluation survey and from the post SCPDI training survey. In this slide, these are the new concepts that participants said they learned across the 6 trainings based on responses to the training evaluation survey. For example, in connecting families using culturally relevant service coordination with Tanya Spence, participants learned about adverse childhood experiences, the impact of implicit bias, the awareness of EI data in terms of percentage of children not accessing EI services across race. In the Advanced Service Coordination Supervision Training with Jackie Chesson, SC supervisors found that active listening, reflective supervision, respect, communication, and empathy are important in supporting their SCs. Next slide, please. In this slide, this is what participants reported that they would incorporate into their work going forward based on their responses to the training evaluation survey. So for example, in the Advanced Service Coordination Supervision Training, supervisors reported that they will coach SCs to empower families and to show empathy and support. For connecting with families using culturally relevant service coordination, participants report that they would practice active listening, cultural awareness, and sensitivity, and to be more aware of families' priorities and needs. For fundamentals of effective case management and service coordination, they reported that they will collaborate and communicate more frequently with therapists and providers. Next slide, please. So sometimes in training, we always want to know, has the training really impacted practice? So what we did in 2021 was we asked service coordinators and SC supervisors to complete a post SCPDI training survey 6 weeks later to really assess if they change practice. So these are some of the main concepts that illustrate their changes in their practices as reported by the service coordinators. Better organization and making time for documentation, learning that the SC role is important, doing better communication with families by asking questions and listening more, using more family-centered best practices and explaining the importance of embedded coaching in services, and empowering and engaging families using patience, empathy, and greater culture sensitivity with families. This includes being more aware of one's own implicit bias and becoming less judgmental. Next slide. This slide shows us what SC supervisors reported in the post-SCPDI training survey 6 weeks later. The ways in which supervisors changed their practices included more frequent contact and supervision with their SEs, using reflective supervision and promoting greater self-reflection with themselves and with SEs, supporting family engagement by using better communication, empathy, and greater understanding of the external stressors families experience, supporting their SEs in using and understanding family-centered best practices and embedded coaching, and enhancing service coordinators' awareness of their own implicit bias and how being judgmental impacts their interactions with families. Next slide, please. So this is the schedule for a spring 2022 series, which will be completed by June 28th next week. In fact, Patricia Gray, I think, is doing the last training on empowering families and caregivers of special needs children. In January 2022, the New York State Department of Health launched the competency areas for delivery of evidence-based evaluations and services in the New York State Early Intervention Program. The document was created by the SCICC Provider Workforce Capacity Task Force to help ensure high-quality EI services are provided to children and families in EI. This document is intended for both current and potential EI providers and to guide adding more early intervention content into graduate curriculum across disciplines and for professional development. Many of these competency areas are actually covered in our SEPDI trainings and in our online professional development trainings on the NYC BEI Learning Management System. This will be reflected in the certificates of completion for all participants when they fulfill all the components of each training. Next slide, please. So in this slide, I just wanted to give a brief summary of the different competency areas that are in the document. The actual link to the document is on the slide, but you can also email BEI at embeddedcoaching@health.nyc.gov if you want a copy of the document as well. So the competency areas include typical and atypical child development and behavior birth to 3, multicultural and diversity factors related to engaging and working with EI families, performing quality evaluations, and providing services, understanding the parent-child dyad and enhancing families' capacity, understanding and the use of evidence-based family-centered best practices, and finally, reflective practice and reflective supervision. This document, it's important to note, also emphasizes the significance of fieldwork placements in EI settings, such as in the home and community, so that students have the opportunity to learn and understand how to integrate these competencies into their work with families. In addition, SDOH, Workforce Capacity Task Force, is working on the companion document for the competency areas. This companion document defines each competency and identifies the knowledge and the skills needed for each area. Academic programs that include our own academic partners across the state have reviewed it, and we are currently working on the edits to finalize the documents. Next slide, please. So since we're talking about the competency areas, it's important to note that BEI has 6 academic partnerships across 4 disciplines: occupational therapy, speech therapy, social work, and early childhood education in 5 CUNY graduate programs and 1 SUNY downstate program, and that they have always integrated these 5 competency areas and fieldwork placements into their EI curriculum. Academic partners use different ways to highlight EI in their graduate programs. For example, Brooklyn College Early Childhood Education created Advanced Certificate in EI and Parenting, while Queens College created a new Master's of Science degree in Early Childhood Special Education and Bilingual Education, and Hunter College launched the SEPDI. The other 3 programs, Lehman College and Brooklyn College's graduate speech programs, and SUNY Downstate's graduate occupational therapy program creates a specialization in early intervention tracks within their master's programs. If you want to learn more about the academic partnership, there's a link on the slide to an article that you could follow up on. And if you're an EI provider, because we're always looking for EI provider agencies that are interested in providing supervision and fieldwork placements in EI settings, please email us at embeddedcoaching@health.nyc.gov for more information. Next slide, please. Don't. Thanks. So BI is revitalizing its New York City LEICC Service Coordination Subcommittee to work on several SC-focused initiatives. First, to help review the content of 3 new trainings for the SCPDI as they are being completed. Reflective supervision with Harula Natal. And I don't know if some of you remember, but we did an in-person reflective supervision training about 6-7 years ago with Rebecca Shimon Chinook, Phyllis Ackman, Elaine Geller, and Harula Natal. So she's agreed to come back and create a training for SCPDI. The integration of natural environments, family-centered best practices, and IFSP functional outcomes with Riza Alam. And in this training, there will be a review and guidance around how to create complete functional outcomes. And the last one is initial service coordination best practices with Jackie Chesson, who currently is a supervisor in early intervention and does 2 of the trainings in the SCPDI. Second, to also advise and support the creation of a text-to-service coordinators text messaging program that will alert service coordinators to the latest changes and policy and procedures, share with SCs relevant and current parent resources, and provide SCs resources for their important work. New York City's Text to Families Parent Text Messaging Program has proven very successful in communicating with EI families, especially during the COVID-19 pandemic. BI believes that text to service coordinators will be a great resource for SC's integral work with families. If you are an SC provider and you want to participate in the Service Coordination Subcommittee, please email BI at embeddedcoaching@health.nyc.gov. I'll be checking that email every day. So are there any questions about our SC initiatives or about the SCPDI or the academic partnerships, about the competencies?
Jeanette, I just wanted to say that I've heard such wonderful things about all of the trainings. A lot of service coordinators have been taking it, and I'm just hearing great feedback. So I think it's just a wonderful thing for the service coordinators and, for agencies to be able to send service coordinators to these kinds of trainings. It's really helpful to all of us. So thank you.
You're welcome. We don't do this alone. We have great presenters and trainers, and Patricia Gray, who's on the LEICC also, is a wonderful partner with us from Hunter College. And so thank you for the feedback, Roseanne. Actually, the discussions and activities in the trainings are really integral for people understanding better the different concepts and ideas we're trying to get across. So that's why we don't record the trainings, because we want to keep the discussion transparent and real. So.
And we're really hoping, Roseanne, that you'll continue to help us sort of look at the curriculum that's being developed. Your expertise has really helped shape it. And our goal ultimately with obviously Jeanette and Patricia is to offer more service coordination training. We want to support providers, we want to support service coordinators and support the delivery of care. Service coordinators are the first people that parents meet in EI, and what they say and how they say it and how supportive they are really shapes the family's entire experience. And we, I guess we needed focus groups to tell us that, but I think we all knew that. But you know, it was good because I think those initial focus groups really helped us target what were the initial topics. But now I think as more guidance comes out and there's sort of a call for training around just also basic information, particularly because recently, and a lot of people talk about, oh, they're, you know, providers are changing and who's leaving and who's staying, but we're seeing similar trends with service coordinators. You know, service coordinators are leaving. You know, there's more turnover in the field. I think we could say that any of our institutional partners here can say that. I'm sure ACS and DOE can say that too. And so, you know, we're hoping that this will help as we onboard new people, more new people. This training series, we can continue building upon it so that we can support our field and support the quality, particularly when we're getting more new staff at a higher rate. So at least that's the goal.
Right.
In the trainings, we really try to empower service coordinators. And one of the things we tell them and we remind them is that service coordination is the only service that's authorized for every family that's referred to the program. And when they realize that, they're like, wow, that is important.
Right. Right.
So
I think it's really important for them to have support, you know, not only from the agencies, but also just from, you know, everyone. And I think that these trainings have really helped them to feel supported and like their job is important. And, you know, that really, I think, just helps to retain them in the field. And, you know, you certainly want to work towards that. So, you know, listen, I'm happy to help in any way I can. But thank you for everything that you're doing. I think it's great.
thank you. Thank you. And I look forward to continuing working with you, Roseanne. I also want to just remind everyone that also the regional directors participate in each of these trainings as well. One regional director at least, sometimes two, participate in the training as well. So this would support and foster collaboration between service coordinators and the regional office.
Any other comments for Jeanette?
Well, I'd just like to say that I know as listening to all the initiatives and the trainings, like I got a little emotional because as a former EI parent, I think service coordinators don't realize how much we need them as an emotional support, because it gets scary to go to the occupational therapist or the PT, and you know, and that person is really kind of holding your hand through the process. And so I see that, and I'm hoping that they get out of it that their role is just as important, and sometimes even more so than everybody who's giving the services to those children. So thank you again, Jeanette, Pat, for all you're doing, because I think this is so great. Like I'm just like reminiscing and just getting emotional about it. So thank you. Right. And if there's no one else commenting, we will go on to Mary McCord, Interim Medical Director and Director of Pediatrics at New York City's Health and Hospitals, Gotham Health, Sydenham, and we'll have also Tanya Corbin, EHREI Project Manager, and they both will be reporting on the EHREI project.
So Mary, Dr. McCord had a bit of an emergency. She couldn't join us, but that's okay. Tanya will present on the content that we developed together. But I wanted to just say that, yeah, Mary had it happens. So I'm gonna turn it over to Tanya. Thanks.
Thank you very much. Good morning. I'm Dr. Tanya Corbin, and I manage the innovative systems integration approach that we will be discussing today. The EHREI, and how by creating an electronic health records component, EHR, we are advancing equity, access, and retention to the early intervention program in New York City. CEI, in seeking to both recover from the impact of COVID-19 as well as reduce the racial inequities in the access to EI, has been focusing on increasing both the number of referrals to EI and the proportion of children who complete the evaluation process, especially among Black children, by engaging in several systems integration initiatives. This initiative, the EHREI, enables for the first time in New York City the use of an electronic health record referral process with bidirectional data exchange and follow-up at the healthcare level. The Borough of Early Intervention expects that by creating an electronic platform for the referral process across New York City healthcare systems and adding the bidirectional data component, which is also a first, it will be increasing awareness, equity, and retention in the EI program and fostering clear communication pathways between EI, referring healthcare providers, and families. These are our participating centers at New York City Health and Hospitals. The 3 centers that you see here in orange were the original 3 pilot sites that we have been discussing in the previous LEICs. And the ones in green are actually the ones that are fully operational in all of our centers. This is across the board now. And the ones in blue are where the providers continue to be training. So Health and Hospitals has hired community health workers who are trained to walk families through the early intervention referral process and program, as well as training the providers. Our other partner sites have chosen specific centers in Brooklyn and the Bronx to pilot the EHREI project. We're in different stages of establishing the EHREI at these centers and look forward to our partnerships. Here you can see the geographical distribution of our sites across New York City to better grasp the scope of our initiative, as the EHREI sites are situated to help us meet our equity goal. So where are we today? Our electronic health record form automated mechanism has completed the testing stage at Montefiore and OBH, where it is ready to launch. It was launched already in April 2022 at NYU Langone. And the H&H centers are currently running an Epic 2.0 version across the board. This upgrade was based on feedback from 10 months of experience with data exchange processes and includes required fields, hard stop features, pop-up reminders, and other user-friendly additions. As well, H&H is now working on version 3.0. Training-wise, there are 75 H&H community health workers and supervisors, as well as 285 providers that have received training on EI and the site-specific workflows. CHWs and supervisors provide ongoing training of healthcare providers, family support, and assistance. The same applies to our other partner sites. There is also an ongoing bidirectional data exchange for all consented referral cases. 315 electronic referrals were processed in 2021. For 2022, we have 535 consented electronic referrals to date, as more sites continue to come on board. So let's look at a little bit of data. When comparing years at Health and Hospitals, the average monthly number of EHREI referrals was almost 4 times higher in the first quarter of 2022 compared to 2021. This is a direct reflection of the initiative being applied across the board. The more sites, the more children we can reach. Here we can see how in the first quarter of 2022, the newer sites were picking up steam compared to the established original pilot sites. And when we look at the EHREI evaluations for 2021, focusing on retention and eligibility, we can see where each bar represents the totality of children referred by the pilot site. The sum of the purple segments are the referred children that have made it to evaluation. versus the smaller yellow-green fragment, which represents the children that have not. Of those evaluated in purple, the dark purple segment displays the children found eligible. The light purple is for those children that have not been found eligible. And I'm going to leave it for a second since everybody leaned in. So in this graph, in the next couple of graphs, the pretty blue represents EHREI data collected in 2021. The yellow-green represents the data collected during the first quarter of 2022, and the purple is the overall New York City data for 2021. When you're comparing geographic distribution, you can see that the reallocation has shifted as more sites come on board. The geographic distribution of EHREI referrals is changing. This is because the geographic distribution of the EHREI referral reflect the geographic distribution of the children that are served by the participating EHREI sites. This produces a shift as well in the distribution of neighborhood poverty among EHREI referrals. And here we can see that as intended, the EHREI is reaching Black and Latinx children. And just as important, we are reaching these families at an earlier point, as the most common age of an EHREI referral is 18 to 23 months, compared to being most referred at 24 to 29 months in the 2021 citywide data. What this means is that if we can identify and provide services to these children at an earlier age, they in turn can benefit by both starting younger and having longer access to the program. Thank you. Any questions? Thank you very much.
Thank you, Tanya.
And
Now we'll
again,
have-
I just wanted to highlight, from our perspective, what a key part that this initiative has played in our recovery from COVID, and sort of harken back to Nora's data, in terms of this initiative. And it's not an initiative because this is something that's really being built into our systems. So, the hope is that it will certainly continue past the point of this grant. And we will be able to sort of continue doing this and ultimately achieve full equity in early intervention, which is what we're seeking to do, which now with the systems that Tanya is creating for us with our medical partners, are really going to help us get there. So that's what I wanted to say.
Thank you, Linda. Now we'll have Jessica Wallenstein, Senior Director, Children with Disabilities, Birth to 5, Division of Early Childhood Education at the New York City Department of Education, presenting on the New York City Department of Education Early Childhood Updates.
Thanks very much. We're going to start with sharing some updates around the DOE's early intervention transition work that we do in close partnership with EI. And then we'll share some other early childhood updates. So I'll pass it to Anne to present the first part. Anne David, who leads the early intervention transition team. Take it away, Anne.
Good morning, everyone. Thank you for having us. Next slide, please. So for this presentation, we're going to provide some updates on the EI transition team, and then Jessica will go over some other early childhood updates. Next slide. We currently have 6 transition coordinators on staff. We have 4 Spanish-speaking transition coordinators and 1 Mandarin and Cantonese-speaking transition coordinator. And each week, our transition coordinators support an average of about 150 families through the CPSU process, and they help them access those preschool options in the least restrictive environment. We are actually seeing more families apply to 3K as they go through the CPSU process. And with the advent of the document transfer system, which kind of replaces the fax as we receive documents from EI, Starting in August 2020, we have received over 93,000 documents from early intervention providers. We are also happy to report that we're experiencing very fruitful collaboration between the CPSE regions and the EI regional offices, which means we are able to support families who are at risk of aging out a lot more effectively. And we are communicating much more openly with both and bridging those gaps between the CPSEs and the DOE offices and the EI regional offices. We also want to report some challenges that we have been encountering. We, of course, have like issues with receiving referrals. There are some families who still kind of like are hesitant with like submitting referrals to, basically as an effect of our COVID-19 experiences. We are also seeing that there is a need for service coordinators to receive more training on using the document transfer system to facilitate that smooth transition from EI to preschool. And we are also aware of scheduling issues with evaluations. There are families and providers who are reporting to us, and we are also experiencing from our contact with families that they are having issues with getting more recent evaluation appointments, and so this may cause delays in the processing of referrals, as well as, having IEP meetings conducted sooner than later. Next slide, please. We want to report that we have completed some family workshops. So we conducted our spring family sessions. We did 12 sessions in March and April on transition and inclusive preschool options. Over 250 participants attended. This is a 150% increase from our fall attendance. Thank you very much to all of you for promoting the event and helping us support promotion of these events to everyone that you are involved in. The recordings will be posted on the Beyond Access YouTube channel as they are approved by our DSISS partners. And right now what's available there are our fall webinars, but they will be coming up very soon. We also in May presented on the transition to preschool in an event for preschool to 12th grade special education forum for families. There is a video available on transition from EI to preschool, which is kind of like a condensed version of our family info sessions. And there are other presentations and resources available when you register at that site. We will share the slides or the links after this LEICC session. Next slide, please. And we also completed trainings for the early intervention service coordinators. We held 3 90-minute sessions at the end of March, covering topics as communicating with families about their preschool options after EI, the importance and benefits of inclusion, and how EI service coordinators can support families through the CPSE process. About 400 participants attended, and we are going to share the presentation slides and the recording for anyone who's interested in the information we shared with service coordinators. Next slide, please. And then there are upcoming trainings that we are doing. So in response to our identified need for training on the DTS, we are going to conduct a training on the 29th. So that's next week for an hour regarding the document transfer system. We will provide an overview to service coordinators, as this is the system that must be used by SEs exclusively to submit documents to the DOE. And in this workshop, the SEs will learn how to facilitate that smooth transition of families who want to access preschool special education services by using the DTS effectively. Registrations are open for the training, so anyone who, all service coordinators are urged to do this. It is mandatory for anyone who has not received any training on the document transfer system, but it is optional for anyone who has done so previously. But we urge anyone who is interested in like helping families transition smoothly to preschool to attend the training. Next slide, please. Another training that is upcoming is a 3-day series with 6 modules created by the EI Quality Childcare Units, which will be offered to the family childcare networks. These are home-based providers that contract with the DOE, and the workshop will cover the following topics on developmental screening, using results to engage with caregivers, how to communicate with caregivers about EI, when they should be referring to EI, and then using results to inform instruction, and of course, including EI providers in early care settings, focusing on the embedded coaching approach. Next, please. And finally, for my part, the 3K offers went out on June 6th of 2022. PK offers came out 2 weeks before that. And offers must be accepted by families who put in an application by June 27th. But families can still join waitlists up to October, even if they have offers that have been given to them on June 6th. If they want to apply for other sites, they are welcome to do that. They can join the waitlist up to October. And we want to remind everyone that families are welcome in all 3K and pre-K for all programs, regardless of whether or not they refer to CPSE or in any stage of the process. We are sharing resources for families who wish to access information on pre-K, 3K and pre-K for all through myschools.nyc. They can call our family welcome centers, our outreach team, and of course, our team of EI transition coordinators. And now I'm going to pass it on to Jessica. And let's start questions.
Okay. All right, thank you, Anne. I will share some broader updates on what's going on in early childhood. First, around our work to foster more inclusive environments in early childhood education settings. So we received funding in last year's executive budget to continue our expansion of integrated settings or special class in an integrated setting, SCIS programs. So we're adding a number of additional threes only SCIS sections in DOE sites. These are pre-K centers as well as District 1 through 32 schools. And the vision here is that it's important to have an option where 3-year-olds with disabilities are learning alongside typically developing peers. And because the way that pre-K rolled out initially, where it was first just pre-K for all for 4-year-olds, you had children, 3-year-olds with disabilities learning alongside typically developing 4-year-olds. So the developmental range was really broad in one class. So we are opening these threes only SCIS sections to kind of narrow that range within a single class. And so we're moving towards having threes only SCIS in every district, which is really exciting. We are, due to funding, due to space, due to a lot of restraints, we can't, open up anywhere and everywhere. So we do have to make choices. And when we're making those choices about where to open the threes only SCIS, we're thinking a lot about, the number of SCIS classes in a site. Our goal is to offer a continuum as much as possible so that there's a 3 SCIS option and a 4 SCIS option whenever we can. We also want to make sure that that SCIS is equally distributed across the city. And when we're looking at that, we're looking at SCIS offered across all setting types, not just public school buildings. So we're also looking at where contracted SCIS is and not trying to compete across different setting types. And then we also look at, the readiness of the staff at a given school to see if this is something that they are ready to open and to build a really strong program. And then on the support side, we know that, as we move towards serving more students in inclusive environments in DOE settings, we want all early childhood programs to have the support they need to do that successfully. We know that, it's not as simple as saying, oh yeah, we're just going to serve more students with disabilities in general ed and in SCIS programs. We know that takes expertise and work. So we have launched an inclusion support team. I think I might have talked about this in the past that it was planning, but it actually officially launched this past spring. We started in a piloting phase where we have a team of coaches who are providing elbow to elbow coaching support to early childhood staff. And it's a small team working citywide. So as part of this piloting phase, we were really focusing on programs that, reached out or others reached out on behalf of them as struggling to serve students and struggling to retain students with disabilities, potentially saying oh no, the student needs a more restrictive environment. This team would then go in and really work with those staff to investigate that assumption and give them supports to meet that student's needs in the inclusive environment to the greatest extent possible, knowing that, of course, for some children, they might need self-contained but we know that there are so many students who can thrive in inclusive environments when given the proper supports. So that team is going to, broaden its work come September. They will continue to work like reactively when programs need support. And then they're also going to be proactively supporting some programs that are offering SCIDs for the first time, programs where we see high rates of referral that are not leading to eligibility. And we're still identifying what data sources we'll use to select schools to whom we will offer proactive support. Okay, next slide. So I've shared with you previously around our really exciting initiative, the enhancement contract for state-approved non-public preschool special education providers, 4410s and 4201s. We are offering them an enhanced contract that will layer on top of their existing contract. And as a reminder, the intention here is to give providers needed financial support and enable them to supplement staff salaries, which will then allow them to recruit and retain teachers and hopefully add special class seats in parts of the city where we know there is a deficit. We rely on these programs to serve the vast majority of students who need special classes. We offer some of those in district schools, but we absolutely need them in contracted settings as well. So we're really partnering with the sector now to meet that regional need through this influx of funding. We also see the enhancement as promoting the least restrictive environment and moving us towards our inclusion goals. The enhancement contract has a mechanism to allow 4410s to open SCIS seats. It also brings those programs in closer proximity with our general ed programs, which could foster moves to LRE. So that's all the vision. As far as where we are now, we have finally received the green light to begin the contracting process with providers that respond to the solicitation in the winter. And so that contracting process is underway. It starts with budget development. So we're working with providers right now to begin that. So I will pause there and see if anyone has questions for me on any of that, as well as if any questions have come to you for Anne around our EI transition work.
Just want to say thank you for your partnership to both you and Anne. I think that you have offered so many resources to early intervention providers, service coordinators, and to our Bureau staff on transition and about inclusive preschool options. We feel like we have so much more information and so much more access to all of the great programming offered through the DOE as a result of this partnership. And I think you have really been a linchpin in connecting us and shoring up our relationships with the districts. And that has been invaluable, not only to us as professionals, but has definitely helped families. Because when we have better relationships, their path is smoother. So it's just been tremendous. And I thank you both for your continued interest and commitment to this work.
Thanks so much, Lydia. And I just want to echo right back to you how valuable we think it has been too, and the real change we've seen for families as they're going through transition. The fact that we, now have this direct line to every regional office and to BEI leadership. It's been such a fruitful partnership. So thank you as well.
We also want to do a special shout out to Jeanette and Ria regarding the developmental screenings. That's a really wonderful partnership. And this is beyond what we're doing with EI transition for families. This is really capturing all of those caregivers who are working with families directly and children who may or may not be in early intervention and could really benefit from the services. Thank you so much.
And I think one of the important pieces in terms of this training, it's not only about talking about the importance of screening. That's important, but I think we have systems have sort of done that. We've sort of said, oh, screening is important, but I think the reason why this curriculum in particular is needed is because it provides information about how to talk to families about those results. and really sort of how to take the conversation from there. I think that is, at least for us, and has been reported to us as a big area where there's a need for more support for providers. So I think that this is a really important first step, and I think, you know, I'm optimistic about what else we can do after this point.
Okay, thank you so much, Jessica and Ann. So next on the agenda is the LEICC committees. For this meeting, we do not have any reports. And so now we will move on to public comment. Were there any public comments submitted?
One second, we're checking.
Okay.
It does not look like we had any public comments submitted for this meeting.
Okay.
Okay.
So there are no public comments. So I'd like to thank all the presenters today for such information that was well received, and I'm so amazed with all the work that's being done and all the progress that's being made. And with that, we will adjourn the meeting. Thank you all, and be safe and enjoy the day.
Thank you.
Bye,
Have a great day, everyone.
Bye.
Bye.